This conference will now be recorded.
Hello and welcome to TNOTA's new practitioner panel Q&A. My name is Morgan Webb. I am TNOTA's Student Involvement Committee Chair. We are excited to host this again this year, and we will begin with the introductions. Avery, would you mind to please introduce yourself?
Sure. Hey guys, my name is Avery. I graduated in April 2021 from Belmont's doctorate program. I'm currently full-time in hand therapy in Mount Juliet, and 1 day a week I practice in outpatient pediatrics utilizing horses for hippotherapy. But before I went into that, I had the unique position of being PRN in some other positions. So I'm excited to talk about this.
We're excited to have you, Avery. Thank you so much. Brittany, would you mind to introduce yourself?
Hi guys, I'm Brittany. I graduated from Belmont with Avery this past April, and then immediately moved back home to Colorado, where I'm currently working as a pediatric OT in the home care setting. So that's where I'm at full time, loving it so far, and excited to share my experience with you guys tonight.
We're excited to have you as well, Brittany. Next, Becca, would you mind to introduce yourself?
Hey guys, I'm Rebecca. I graduated last year too. I am currently working with Metro Schools as a school-based occupational therapist, but I also do PRN at a nursing home, and then I just started working at this boxing gym that is specifically designed for people with Parkinson's. So I have kind of like a whole spectrum. My kids at school, I see anywhere from preschoolers to 21-year-olds. I have pretty much the whole spectrum.
Awesome. Thank you, Becca. Excited to have you. And Amanda, would you mind to introduce yourself?
Good evening, everyone. I'm Amanda Labonte. I graduated also from Belmont in 2018 and have been working as a traveler ever since, predominantly in skilled nursing facilities and home health. But currently, I'm actually working in pediatrics in the school system. And I live in the Pacific Northwest, so most of my traveling has been in Washington State and Oregon, but I also had the privilege to travel in Hawaii for about 6 months as well. So I have experience in a little bit of everything, and I have a passion to talk about travel if anyone is specifically interested.
Awesome, Amanda. Thank you. We're excited to have you back as well. So we are very fortunate to have this wonderful group of practitioners. With that, we would love to go ahead and open the floor to questions. While you all are thinking of any questions that you may have, I'm going to go ahead and pull from a list that we have of questions. If you would like to submit any questions, again, please just make sure you can unmute and let us know what questions you have, or you can simply type them in the chat box and we will take care of those. So we'll get the ball rolling and start with the biggest advice for navigating the OTA-OTR relationship.
All right. So before I started my full-time position, I had a great time PRNing a lot. I highly recommend it. And if anyone has more specific questions about just the PRN life, I'm happy to answer questions about that because it can be intimidating, but it's also really fun. So I was hired shortly after I passed the NBCOT with STAR Physical Therapy. And they were trying to do kind of a unique thing and introduce in-house occupational and physical therapy into a assisted living facility. So not a traditional skilled nursing facility that we're normally seeing it, but in an assisted living facility. So it was supposed to be a really unique blend of almost home health because the residents lived there. But sort of an outpatient feel as well because we had a therapy gym inside. It was really cool. So I came on and there was already a certified OTA working there. She had been working there for I think about 6 months or so before me. She was fairly new to the profession herself, but again, she had a solid 6 months on me in as far as like her experience working with these particular patients. So I guess my initial advice coming into this is that OTAs are your colleagues first and foremost. I think sometimes in school, it makes it seem like there's going to be like this very clear hierarchy, and it's just not that way when you're in clinical practice at all, at least in my experience thus far. So I came into it and just straight up kind of told her, hey, you've been working with these patients. As far as I'm concerned, you're the expert with these patients so far. So I just kind of set up a casual like relationship right off the bat. Like, you tell me about this person. How have you been experiencing this? What do you think about this person? And then I went and almost shadowed one of her sessions, but again, not necessarily in a I'm watching you, like I'm reviewing you, or I'm going to critique you. I wanted to truly see, what one of her sessions looked like with a patient. So colleagues first and foremost, there's not that hierarchy that they kind of almost make it, or at least to me, they made it seem like there was going to be in school. Okay. And then I think in these situations, you should take the privilege of having two sets of eyes on patients. That is huge, because I remember feeling like when I graduated, I'm super confident and I know everything that there is to know about OT, and then you go treat your first patient and you're like, I know nothing. And so it's so nice to have someone else that's there helping you, and you could almost think of, their main job is the interventions part and your main job is the evaluations. And so to me, I was overwhelmed by evaluations, because yeah, we learn them in school, but it's a different ball game when you're out there in the beginning. It just is. And so I was grateful to be able to focus in on the evaluation part of things, because that's where so much of my education had prepared me for. And I allowed her to take on so much of the interventions. And I learned from her. I truly did. There were times I would come in, because I would do progress notes and evaluations. So I got to see the patients every 4 weeks, while she saw them 2 or 3 times a week. So I would come in every 4 weeks and I was like, wow, I can't believe, for example, she had made a simple picture on the outside of someone's room of the orientation of her house key, because the patient was getting confused about how to orient the house key in order to unlock her door. And I was like, man, that's super smart. And so it was really fun to like watch her interventions and just see what a cool lens that she had. So yeah, I think my biggest advice in that realm is just use your strengths, which is, the evaluations and those outcome measures, the assessments, and then allow the OTA to help you with interventions. And I brought up some things that I was like, well, I have experience with this in certain patients, and I think, this has worked. Why don't you try it and let me know how it works for you, or I'll try it in my next session. And so just right off the bat, I think we had a great relationship. And then a short little story to end it. I also worked in a skilled nursing facility where there was a very experienced OTA, and she taught me how to give a shower to my first patient. I had never done a clinical in an inpatient rehab or a skilled nursing facility. And I walked in one day as the PRN OT and someone needed a shower. I'm like, here we go. And I relied heavily on my OTA to just pointers that you just don't learn in a textbook. So colleagues first and foremost. There's not the hierarchy. It's an even playing field out there, and use them the same way that you would use an OTR colleague.
Great advice, Avery. Thank you so much. That's awesome. We have a question submitted. I'm going to go ahead and read it. The question is, have any of you worked in settings that you did not have a fieldwork rotation in during OT school? If so, how were you able to gain confidence / resources / expertise in a new setting? And what are some of your favorite resources you have used to build up handouts activities for clients, any setting or specifically pediatrics?
I can answer that. So most of my field works was in adults and older adults. I really wanted to work with adults. The part of my second field work had a few kids on my caseload, but not many. Most of it was older adults, but I now work with kids because I work in the school systems. And I was terrified. I mean, absolutely terrified to start out because I had never done OT with kids. It's a completely different ball game than teaching someone how to get dressed or take a shower. Yeah, it's different. So how I did that was I found CEUs that I could take, even if they weren't like specific, like, oh, I'm going to get my credits to get my license. Like I just looked for opportunities to learn. I found a mentor who we had a meeting every single week where it was probably like 30 or 40 minutes where I would just ask her questions because there was so much that I didn't know. I wasn't afraid to ask questions to other people, watch other things, and just generally just take on that initiative myself, just trying to like figure it out. I looked at different websites, watched lots of YouTube videos on how to do assessments. And oh my goodness, those sheets that your teachers have you do, or those YouTube videos that your teachers have you do where you like act out how to take an assessment, I use those all the time. I just Google like how to administer -3, and it usually pops up an OT student talking about it, and that's what I use to base mine off of. But it's a lot of initiative on your like own part, but I wouldn't be scared to do it because it's really fun and I've learned a lot from that. Does anyone else have anything they want to add?
That's
I
great
would
advice,
just add, I
Becca.
can relate
We have
very much to what Becca's going
Yes.
through. I'm in a similar boat. I also was prepared to work with older adults and currently am working in pediatrics in a school system. And so, very similar to her experience, it's been a lot of humility because I really don't have any experience with children. And it's been a lot of growth, certainly, but a lot of humility and being flexible and relying on people around you to mentor you. Absolutely.
It's great advice. We have another question, and that is, what were some of the biggest obstacles you had to overcome as a new practitioner in your first year?
I can speak to that among many things. I think confidence in knowing that you know what to do. Like when it comes down to it, that sounds silly, but you did go to school. The knowledge is buried in there somewhere. And I found rather than just when I sit down with a patient for an evaluation for the first time, rather than getting wrapped up in trying to hit all the different boxes that you're supposed to hit, I would just, in my mind, I'm like, just ask them how they're doing, and let the conversation flow because we are natural conversationalists and activity analyzers, whether you realize it or not, you are at this point. And so just asking someone how they're doing and ask them, their hobbies and what they did last week. And the conversation leads to 50% of the answers that you need already. And you just start creating a picture in your mind, a clinical picture. So having the confidence to just start, and then things will flow from there. But also, I found myself specifically in the setting of hand therapy, anxiety ridden about that I was going to mess up a protocol because it's big stuff, right? Like if I told the patient to, flex their hand and they weren't supposed to do that yet, that could potentially have consequences. But so I double checked and triple checked and asked my mentor and, the surgeon, and slowly you do gain confidence, but just have the confidence and don't let the fear cripple you from being the great OT that you already are. You can always double check if you have a question, but don't second guess yourself maybe as often as I did.
I also wanted to touch on a few things that were difficult in my role, like transitioning from student into first year practitioner, but I had a unique situation come up with my MBCOT exam. Long story short, I had a job lined up after school, which I was really excited about, but I had to, when I went to go apply to take my board exam, the only dates left in the month of May were 5 days from when I was signing up for my exam. So I ended up cramming for the MBCOT exam in 5 days, which I don't recommend, but also know from my experience that kind of what Avery said, we know a lot more than we give ourselves credit for. So have trust in yourself, have trust in your knowledge, both when you're going into boards and when you're going into your first job, and be flexible like we already know. And then the other thing that was kind of surprising to me and a little bit difficult going in as a first year practitioner was the amount of work outside of visits and daily notes. And I think this is something that's touched on a little bit in school. For me, I'm in home care, so my situation is a little bit different, and I have a little bit more responsibilities than maybe a practitioner does working in a hospital setting. But things like communicating with the parents, making sure I'm reaching out to doctors because the doctor's not in the same facility as me, so sending those emails, writing letters of medical necessity does take a lot more time than I anticipated. And then specific to Colorado, we have a lot of state funded resources for pediatrics. And so I've really had to take a lot of time familiarizing myself with what's all out there and how I can get those resources and that information to my patients. So I think that was the most surprising thing and challenging thing, is all the extra stuff that we don't really think about, or that you're not really thinking about on your field work either, because your CI is probably still doing a majority of that. So that's what's been the most difficult for me, but it's all okay.
Great insight. We have another question. Question is from Alyssa. Did any of you have to negotiate a mentor, or was that included within the job offer?
I have a mentor, and I did not have to negotiate for that. It's a program set up through Metro Nashville Public Schools, like OT department. So they just provided me with one, but that was something that I looked for when I was job searching. Every place I interviewed at, I would always ask them if they have a mentorship program. Even if they didn't, is there a way that I could have one? And I definitely recommend making that a priority, because that has been the biggest lifesaver for me and giving me that confidence, because like we've talked about, that transition process is very difficult, very fun, but difficult. And so having that mentor is really important. And TNOTA actually has a mentorship program if you guys are interested in it in the future, but that is not, that's more like, I would say, on the professional side of it, like how to be professional, just different things like that. But having a mentor through your job is more centered on like your job specific aspects. So I highly suggest asking for it. And if they don't have one, look around and see if you have if you know of any OTs that have been in that field in your specific area for more than a couple years, not first year. I do not feel like I have the expertise. I've only been doing it for a year to be someone's mentor. You want someone that has quite a few years in that one area so that they can be your mentor.
And I would just add on, it looks a little bit different in the travel world. So for those of you who might be interested in travel therapy, mentorship is available, but it's something that you really have to advocate for. As travelers, you often are not placed as the highest priority in the organization because you're not there for very long. Usually you're only there for about 13 weeks or so to cover for someone being out or short staffing issues. And so it's really important as you're starting out, especially if you're in a setting where you did not have a field work and you're not feeling that confident, to strongly advocate for mentorship to be in writing. So in your contract, say, I'm going to have X amount of hours with someone at my site who's going to mentor me. Many different agencies will promise mentorship, and that's a wonderful thing. But similar to maybe what TNOTA can provide that Becca was talking about, it's not going to be job specific always. And so it's really nice to have somebody on site who can mentor you. So just make sure if you are going to travel that you're advocating for that, because it's really important as you're starting out. I got very lucky. I had someone who trained me for 3 weeks, which is pretty unheard of in the travel world, but it was because I was a strong advocate for myself and made sure that I had that available.
That's great advice. All right, the next question we have comes from Hannah. Hannah asked, what was the job search process like for you? Where did you start?
So I'd love to talk about job hunting. I'm going to talk a little bit about just general job hunting because I'm sure not everybody's going to be a traveler starting out. So generally speaking, unfortunately, there's no magic place. And I remember being a little disappointed starting out. I really had no idea where to look for jobs. So it turns out finding OT jobs is very much like finding any other job. So that's going to be looking at places like Indeed or Monster.com. There's also a job board through AOTA. It's called AOTA Job Board Link, and they oftentimes have some great jobs on there. So that's something to check out, and you do not have to be a member of AOTA to utilize that. So please make sure you use that as a resource. And then also making sure to network for yourself. That is the #1 way to get a job. So if you have a fieldwork placement, talking about an interest in working there in the future goes a long way. Certainly if you do a great job on the fieldwork, they're already going to be thinking that way if they have an opening. But also talking to your classmates, talking to your fieldwork coordinators and your mentors that you're relying on to see if there's openings that you hear about, because a lot of people will find jobs through alumni groups or things of that nature. And then also Facebook or other social media sites might be a good way. There's some lots of job sites available specific for OTs looking for work on Facebook. How, as a traveler, it works quite a bit differently. So trying to find jobs as a traveler is usually dependent on finding a good recruiter first. So there's hundreds and hundreds of thousands of recruiters out there. There's hundreds that work at hundreds of agencies, I should say. 100,000 is a little ridiculous, but there's a lot out there. And so finding a good recruiter who's able to search for jobs for you is really, really important in the travel world. So I won't talk too much about it, but if you're interested specifically in learning more about job hunting, feel free to seek me out specifically.
I'm just going to add real quick to that. One of the best things that I feel like I did when I was doing the job searching was I looked at businesses around me, specifically really for my PRN job. So I looked at skilled nursing facilities around me, and I went in and brought them my resume like in person. I would just go to the desk and I would say, hey, I'm an occupational therapist, which was one really fun to say because I had just graduated. And I would tell them like, I just want to bring this by and drop it off in person. And 99% of the time, they would just give it to the director of rehab. But sometimes the director of rehab would come out and meet me, and it was just kind of like a quick face-to-face. And it just shows that you are someone that's going to go the extra mile. I'm not going to lie, it's scary. I gave myself lots of pep talks before I got out of the car, but I dressed up nice, like I was going to an interview. And I would just walk in, and I typically had a cover sheet, my resume, and then I included a little picture of myself just so that they could put a face to the name. So I highly suggest that. It's scary, but it works really well.
That's great advice. Thank you all so much. We have had our 5th practitioner join. Helene, would you mind to introduce yourself to our participants?
Sure. I'm Helene. I'm an certified occupational therapy assistant. I graduated this past May from Nashville State. I currently work at TriStar Skyline. I'm considered a float position, so I work both on their acute care side and then the rehab side. I go wherever I'm needed, but it's an adult population, and I've been there almost 6 months.
We are excited to have you, Helene. Thank you. We are going to address Sydney's question next. Sydney says, addressing Avery, I'm very interested in being a CHT. Can you talk more on your experience with hand therapy? Do you like it?
I love it for sure. I had the privilege of landing a level 1 and a level 2 in a very traditional outpatient hand therapy setting. When you work in an outpatient ortho clinic like that, 99% of the time, the PTs are handling, foot, ankle, knee, up to the neck, and the OTs are handling shoulder down. In my level 2 in hand therapy, we actually are as specific to just elbow down. And I loved it. It was challenging. It's very biomechanical. You got to know your anatomy, like frontwards, backwards, sideways, all the ways, which can be intimidating, but it's so cool because there's so much to learn. I think it was just the luck of the draw for me. I had an amazing mentor who is awesome. She is a CHT. So just to touch on, if you don't know, to be a CHT, you cannot sit for that board exam until you've had 3 years of experience and 4,000 clinical hours in hand therapy. So it's a journey. They want to know that you want it before you take it. And not to mention, I mean, there's just too much to learn. There's not any practical reason to think that you could sit for that exam successfully without that much experience. As a matter of fact, I think the passing rate is something scary, like only 48%, even after you have that much experience. So hand therapy is intimidating, but it's super cool. I don't personally find it repetitive because the surgeon that I work for is a very young and energetic surgeon. So he's always kind of pushing boundaries, if you will, about what kind of surgeries he does. And so I'm constantly having to research protocols, and we're always talking back and forth. Sometimes I think I know the protocol or how I want to attack it, and then I'll talk to him and he's like, actually, I'd like you to be more aggressive with this patient. I was really, really happy with the repair and surgery, and I trust this patient and I trust you, so let's go for it. And I'm like, oh my gosh. And that's where the confidence things comes in. So it's really, really cool. It's definitely an area, if you are adverse to any wounds or wound care, basically, then it's not for you. Because I see wounds every day, and sutures and infectious wounds and incisions and things like that. So if that's not your gig, then probably not for you. But I would say another tough part about it is it's a manual job. It's very tough on my hands. We joke with our surgeon all the time that he's going to be providing us with some services here and probably earlier than we otherwise would have. So it's a very manually demanding job, and you've got to take care of your own body. But it's super cool. And it's really fun also to see the progression. Generally speaking, I would say with 75% of my patients, I get to see post-op day 5, no function, little to no function, to week 12, week 15, and they're fully back to function. So if that's your game, hand therapy is definitely for you. So any more specific questions, I can put my email in the chat or whatever. I'll talk all day long about hand therapy, but I don't want to take up our entire time. So
Thank you, Avery. Thank you for being such a great resource too. Really appreciate that helpful insight. We're going to move on to the next question. The question is, what is difficult about getting hired for a job if you did not have a fieldwork placement in that setting? Was it difficult getting hired?
So of course, having the fieldwork experience is going to make you more competitive for the setting that you're applying for. However, it doesn't necessarily mean that you wouldn't be able to get that placement if you don't have it. For example, Becca and I both gave examples of how we didn't have any experience in where we're working currently. So the most important thing I would say, just to kind of add on to that question, is that trying to put yourself as a unique candidate as much as possible is really, really important. So some of the ways that I do that in, the multiple interviews as a traveler, I interview for a new job every 3 months or so. So I've done it quite a bit. And I'll tell you some of the things that set me aside. One are that I volunteered to be on board positions in school. And so I was the social chair for the, Belmont OT Association, Student Association. I participated in AOTA events, even went to one of the conferences. So those were things I was able to include into my resume that made me stand out maybe from other new graduates. But also in my interview, I made sure to talk about my dedication to occupation-based therapy. A lot of times in the clinic, I've traveled all over and seen again and again, there are a lot of therapists who think more of a medical model, and some of their treatment looks a little closer to physical therapy. But OT is experiencing a renaissance, and we're trying to go back to our roots and really provide that good occupation-based care. So the more that you can tell that to the potential hiring committee as you're doing your interview and setting up your interview, I think the better, because it helps to show that we're trying to move our profession in the direction everybody wants it to go, which is going to give us the best outcomes based on research, but also be the best client-centered profession we can be. So make sure to highlight that. And then also, I think it's really important to try and learn everything you can about whatever setting you're going to be going into. So in the interview, you can sound very knowledgeable about what you're going to be doing, and maybe even shadow there if possible before the interview to kind of get a feel for everything.
Awesome. Thank you, Amanda. All right, next question. What are 3 things you wish you knew as a student on the last level 2 fieldwork?
Yeah, I can answer this one. So for your last field work, that can be pretty intimidating. And honestly, like the biggest advice that I can give you is to take the initiative. As I look back on my field work, the only thing that I wish I would have changed is challenging myself even more. So like I view it as like a time where you have that support and you have someone that is going to be watching you, but not in like a judgmental way. They are watching you so that they can support you and like say, hey, that's a great way, but have you ever thought about doing it this way? And so if your CI is like, hey, I'm going to take this patient because it might be a little bit tricky, you can say, actually, do you mind if I take just part of the session, or can I try all of the session and have you close by? Just offer to do as much as you can. Starting out from like week 1, I would be like, hey, I'm going to practice writing soap notes. Can you read over them? Just really view it as a time for you to grow. Don't view it as a test. And like that was probably my biggest mistake in the beginning, was I was so concerned with what my CI thought of me that I wasn't viewing it properly. Like I was viewing it more as a test requirement that I had to pass to be able to become the OT, when really I should have just been viewing it as like, okay, this is a time that I can be super vulnerable and use it to grow. It's okay to make mistakes. That's another thing. You're gonna make mistakes, and that's okay. I would suggest that you're very honest with your CI when you don't know something. If they ask you a question, say, I don't know, but I'm going to find out. And so that night or on your lunch break or whenever you have the chance, go through, research it, and come back and say, hey, this is what I found. Is this correct? Is this what you think? Just really take the drive so that you can really learn, because that energy is what's going to push you into doing like your own job. I still look up stuff all the time now when I face patients that I'm not sure what to do with. And then, yeah, I would just say be very honest with your therapist or with your lead. Say, be honest when you don't know something, and that's okay. But take the initiative to figure it out. It's not their job to teach you. It's your job to figure it out. They're there to support you.
That's great advice. And Becca, can you talk a little bit more about the job search as well, and kind of in regards to around the NBCOT, after the NBCOT, and what that looked like as well?
Yeah, I remember being just as confused as probably most of you guys are of when should I start putting my resume out there? When should I start applying? I applied after I took the NBCOT, but before I was licensed. Those are two different things. The licensing process takes a very long time, especially during COVID. So I did it as soon as I finished the NBCOT. I made sure my resume was good and I started passing it around. I started applying on Indeed and all those other sites. I do have friends that did take it before the NBCOT and they actually did get jobs, but it was like contingent on them passing the NBCOT. However, most of the places that I applied for had a little box that you had to check that said, are you licensed? Have you taken the NBCOT? And I kind of felt like if I didn't click that, it would just kind of shuffle it into another pile that they didn't look at. But that's okay because there's nothing wrong with just trying. Really, there's no correct answer. But I think you probably have a better chance of being in the right pile if you have already at least taken your NBCOT, because being licensed, chances are you're going to get licensed. So I just told them my license sure is in the works, and then it was fine.
So I had a little bit of a different experience when it came to the NBCOT and applying for jobs. I started applying for jobs in March and we were set to graduate in April. I just kind of thought, what the heck, it's worth a shot, see if I can get my resume to people. Luckily, with moving to Colorado, I feel like I was at an advantage because there's only one OT program in the state of Colorado. Well, we'll say two. But I knew I was coming to a state where there was not as many OTs graduating and coming into the workforce compared to somewhere like Tennessee. So I got a job offer after applying. I got a job offer in March, and they knew after talking with them, like, I graduate in April. I'm planning on taking the boards in the middle of May. I should be licensed and ready to start seeing kids in June. So they hired me knowing that. Well, with COVID and stuff, there was a little bit of run-in with the NBCOT, but I ended up passing the boards in May. In Colorado, it only took me 5 business days to get my license. So again, a different experience. It depends on the state and where you're trying to get licensed. So I passed the boards, found out 2 weeks later, got my license within 5 days, and then started seeing kids the following week. So I think it's okay to start applying for jobs before you sit for the boards or before you're licensed. Just make sure the person that's hiring knows that and is willing to be flexible in case things don't go as planned like it did in my situation. So just make sure your employer is flexible, make sure that you're maintaining that open line of communication as far as like, I was letting my employer know, okay, I finally signed up for the boards, and then I let them know as soon as I passed, and then I let them know when I submitted my license application. So just keep that open line of communication and hope for the best.
Awesome. Thank you, Brittany. Next question. How should we go about job searching?
I just wanted to There we go. I just wanted to briefly add on to Becca and Brittany before I answer this next question. There's actually a couple different resources that can be really helpful for looking up your state's processing time frame for licensure. As a OT that travels, I'm licensed now in 5 states. I had to think about it. And so it's different for each state, like they said. Oregon was 3 days. Washington State was 8 weeks, so as you can tell, it varies significantly. But Core Medical Group or just doing a Google search are both ways to find a listing of licensure timeframes. Of course, these are an estimate, not a guide, so it just gives you an idea of what you can expect. But it's helpful to have an idea if you're not going to be working in Tennessee, where it is a very long wait. We know that already. If you're working in a different state, it's nice to know. So thinking about job hunting, so we talked a little bit earlier about some of the ways to go about searching for jobs. I thought Becca added on such a great idea of contacting individual businesses in your area and reaching out to employers. And that's an excellent way to go about job hunting because they have that personal face to put to your resume. But also a lot of employers like to hire people on a PRN basis. And maybe then you're only coming in, once or twice a month or once a week or so, but it's a great way to get your foot in the door when other positions are open. Additionally, I would add that I think all of us tend to come out of school, I shouldn't say all, but many of us come out of school with kind of a set idea of where we want to work. And I know that was very true for me. But unfortunately, reality of the workforce is that it changes dramatically. And so during COVID especially, flexibility is the key with a job hunt. So for me, I had hoped to start working right away after I had graduated and gotten my licensure. I was ready to start, beginning of June. Unfortunately, with the travel market at the time, it was several weeks later before I actually got to start and found a job that would work. And so try and keep an open mind. And if you're somebody who's going to need financially or just emotionally to work sooner than later, then it's never too early to start. You can start contacting employers, putting your face out there, let them know you're going to be graduating, around this time, hopefully looking for work, because then they'll at least be keeping you in the back of their mind when they have openings that come up. So job hunting also, it's important to stay organized. Keep a list of the places that you've talked to, that you've applied with. That way you're not accidentally going back to the same employer if you are putting out many resumes in your community.
Awesome. Thanks, Amanda. Next question, when should we reach out to potential employers and how do we practically go about doing that?
So I'll take this question. I know Becca already touched on this, and so was Amanda. So reaching out or when to reach out to potential employers, I started my job search. I definitely sent my resume out a little before I graduated, but I would say once I took the MBCOT is when I sent more of my resume out. I went through Indeed to find jobs. I also, you can also send an email, if you have a director of rehab's information, or if you can find that easily on a website, it doesn't hurt to email them your resume, or Becca said, you can go in there in person, because it just adds a more personal touch. I would say in terms of actually getting interviews from jobs, I didn't get interviews until I taken the NBCOT, and then I don't think I was considered for jobs until I was licensed. So that just may vary depending on setting and things like that. But you can definitely do it before you graduate, but maybe do a little bit more once you take the NBCOT. That way they know, I'm about to get licensed. I've already taken the steps to do so.
Thank you, Helene. All right, next question. What are the most common fieldwork mistakes?
So from what I've talked with my fellow peers and then just OTs in general who have had fieldwork students, I would say that the most common mistakes are one, being overly confident and really just thinking that you know everything. But then also on the other side, not feeling confident enough where you kind of second question yourself, I just really want to encourage everyone to remember that they have all of this knowledge from school. You do know like really everything that you need to know. It's just learning how to transition it into practice because it looks different than it does in the classroom. However, you know, don't be afraid or don't be too confident that like you don't take the advice of your CI. They have been doing it for a while, and so while it might look one way in the classroom, it might actually work a little bit better a different way. And so just having that humility to like accept their criticism and like really just like see how they're doing it and kind of step into it. I would say another one is criticism. You're going to be talking with your CI a lot about ways that you can do things better. And sometimes it can be really discouraging if we're being honest because you just kind of feel like everything is being constantly critiqued. I was so tired by the end of it of having my CI critique my soap notes. I was like, you know what? I don't even care anymore, which I did. And that's not the best attitude to have. But just learn ways that you can accept the criticism without kind of like taking it too personally. I would take notes in a notebook. That's something my teacher taught us to do. Take notes in a notebook. That way you're not having to look them straight in the eye, which can be really hard when someone's criticizing you. And it's not bad criticizing. It's just giving you critiques. And then I would try to find ways that I could incorporate what she said into my practice later on. And I had a list of like ways that I could improve. And then I would say that the other one is honestly not being professional. That was the most common thing that most CI said. You need to be on time. It sounds very like duh, but apparently people aren't on time. So be on time, be respectful, follow the company rules, follow HIPAA. If you don't know HIPAA, brush up on it because that's something that everyone needs to know and you are required to follow. When you're writing your SOAP notes, when you're talking to your CI, when you're talking to other people, whether it be in person or email, you need to be professional with it. There's no, short lingo. Always be more professional than anyone else there because you are a student. I would have my CIs email me back like one-word answers or something like that. But I always made my emails super professional because that goes back to that humility of like, yes, I'm a student and I am learning. You just always be way more professional than everyone else. That should be your goal. And then I think the last mistake that people make is going back to what I said earlier about not taking that initiative, showing that drive that this is my future job, this is my experience. I am going to do the extra work that it takes to learn. Do not expect your CI to teach you everything. If you don't know what a rotator cuff tear is, or what muscles it has, or anything like that, that's not your CI's job to teach you. You need to go and look. And there was stuff that I thought I knew, and then I would get to it and I'd be like, oh my goodness, I don't actually know what that is. Like, this is really embarrassing. I didn't know what a bedpan looked like. And so like having to look up all DME, because at that point I realized I've not seen half of the DME in person. And so I took that upon myself to go home and like research all of it. So next time it came up, I could figure it out. But yes, so that's all it is. Just be professional, be respectful, be humble, be confident, somewhere in between those two, and take that initiative.
Great advice. Thank you, Becca. All right. This is the last question that we have. If you have any other questions, please feel free to unmute or send those questions in the chat box. The last question is, how did you overcome your fears and grow the most?
So going into my job, working in pediatric home care, one of the fears that I had starting out was that the parents were watching me do these sessions, and I felt like I was being watched and judged by the parents, which is ridiculous now that I'm 8 months into this. But for something like that, whether it's on a like a field work setting and you're working with a patient and you feel like you're being critiqued by your CI or even the patient you're working with, we keep kind of going back to this theme, but you know so much more than we give ourselves credit for, both as students and new practitioners. So have trust and faith in what you're doing. And then it also always calms me down thinking from the parent perspective. The parents have no idea what I'm doing with their child. They don't understand the activity analysis like we do. So at the end of the day, like, you have to trust yourself as a practitioner and know that what you're doing is evidence-based, and you went to school for a really long time to know how to do this. So just have faith in yourself. The other thing, and we've touched on this a little bit as well, advocate for yourself as a new practitioner. Don't be afraid to ask questions. Don't be afraid to say, I need more help with this, whether that's documentation or you need more mentorship or whatever the case may be, especially if you're in a setting like travel therapy, like home care, where you're not in, where you don't have your community of OTs or other therapists with you. I think that's the biggest thing that I've had to overcome, is just being okay asking for help and knowing that it's okay to say, I don't know. I need more assistance with this, or I need to learn more about this, because that has been where I've learned the most as a new practitioner, is by asking those questions and reaching out to my colleagues to get clarification on things. So trust that you know a lot, but also be okay when you don't know and be willing to ask for help.
Thank you, Brittany. Avery, did you have something to add on to that at all?
No, but my valuable advice flows pretty well with that.
Perfect.
So definitely don't be afraid to ask questions. And my little golden nugget is, when school ends, don't stop studying. Or if the word studying makes you want to puke right now, don't stop learning. I honestly study, I don't know if I say just as much, but a lot. But it doesn't feel the same as when I was in school, because I'm in a job that I love and I'm so passionate about and so interested in. So to me, studying feels like getting better at what I do now, and you get paid for it now. So it does feel a little bit better than just regular studying. So don't stop being a learner. And I guess to tack onto that, even if you do feel like you're stuck not learning and not excited to learn, then you might need to look for a different setting, honestly, because this is a profession that you should be excited, for the most part, about going to work. It's not always fun at 6:30 in the morning, but for the most part, you should be pretty excited about it and want to get better at it and learn. So try to keep studying.
That's great advice. We're going to go through the remainder of our practitioners, and they will share their most valuable piece of insight. Brittany?
I have lots of insight, but I think the most helpful insight is and this is totally random, but find a good place to do continuing ed credits. I've been using occupationaltherapy.com because somewhere in my email from Belmont or from some app I signed up for studying, I had like a free year of it, and it gives you like unlimited continuing education credit. So going off of Avery, be a lifelong learner, continue to educate yourself on your area of expertise, and find a good place to do CEUs.
Helene?
Along the same lines, like what Avery and Brittany have said, but definitely don't be afraid to ask questions, and don't be afraid to rely on like practitioners who've been doing this longer than you. going to Skyline for me was like a bit of a learning curve because they're a level 2 trauma hospital, and my acute care rotation and fieldwork was not trauma based. So a bit of a learning curve there, but everyone on my team, whether it be PT, OT, speech, has been helpful. Anytime I have a question, anytime I'm like, hey, I'm not quite sure how to handle this, they've been able to help me out. So don't be afraid to like ask other disciplines or those that are more experienced than you to help you out if you get stuck with something, or like, I don't have a lot of experience with this. Can you run this, through with me?
So the most important role I feel that we have as OTs is to be an advocate for the clients that we're working for. And the people that we work for oftentimes are vulnerable, and they don't always have above an 8th grade education. And so one of the things that I'm really passionate about, and I would encourage you all to be too, is making sure that the language that you're using with clients is clear and as simple as it needs to be to make your point. There's a lot of practitioners that do such a great job speaking medical jargon among their team, their discipline, and their doctors, but have a really hard time turning that off and speaking in a normal, clear way to their clients. And a lot of times the clients are clear, you don't understand what's going on at all, and don't know what's going on with their own bodies. And so it's really, really important to speak in a way that's clear and easily understood by the clients that we work with, because we are their advocates. And oftentimes we are the person that's talking to them in the most client-centered way, instead of saying language that's over their head and doesn't make sense to them. And so it's really, really important that we're fulfilling that duty.
My advice would be to not let fear hold you back, whether that be from trying something that you haven't done a field work in or don't have much experience in, because you have the knowledge, you just might not have the experience, and that's okay, because there are so many ways to gain knowledge. And even though I really didn't have much experience with pediatric OT, I'm still helping my kids because I have that baseline of like the knowledge of it. It's just figuring out how to treat it. But I still am able to help out my kids, and every day I'm getting better at it. But also, like, don't be afraid to look for different out of the box ways to do occupational therapy, because I heard someone once say that, like, occupational therapy is what you know, it's not who you are. So for instance, I do the boxing with the people who have Parkinson's, and that's not OT, but my knowledge base of OT helps me to be able to serve those people. And so if you have a great idea, like our capstone projects for people that are in the doctorate program, go out there and try to do it. It's amazing what you can do with just having that knowledge. Don't be afraid to think outside the box and do something that is not really what you traditionally thought as OT. So yeah, just don't let fear stop you, because I promise you, you can do it. It might be a little hard, but you can do it.
Awesome. That's great advice. I am going to pull up another screen and go over a few final announcements. I do want to just thank our practitioners for a very excellent presentation this evening and a really great, valuable insight. I hope that you all learned a lot and that this was beneficial for you all. As a reminder, this session was recorded. It will actually be posted to the TNOTA student section website by end of day tomorrow, February 2nd. I sent a link in the chat box to please complete the student quarterly virtual chat post survey. This just lets us know what we did well, what we can improve upon, and what you'd like to see in the future. And for those that are listening to the recording, you can access that via the TNOTA student section as well. We would love to have your feedback as well. It should take you probably 3 minutes or less to complete that survey. And then finally, we ask that you please join us on our next quarterly virtual chat on April 5th. We are very excited to announce that NBCOT themselves will be presenting to us directly. On NBCOT now national certification exam information you need to know. So please make